Chapter 14 Review, Myocardial Infarction. Just realize that the recognition of infarction on an EKG relies on the detection of morphological changes such as changes in shape of the QRS complex, the T wave, and the ST segment. Also know the difference between the two myocardial infarctions. You have STEMI and InSTEMI. Know your zones of infarction, which is zone of injury, zone of ischemia, and zone of infarction. Make sure you read up on the 3 I's of infarction. And I'll try to make my notes so you can see. Also, when you're learning the 3 I's of infarction, make sure you understand how they're located and where their significant differences are. Know how you can tell ischemia and injury to a myocardial tissue, which is cause repolarization changes such as ST segment and T wave abnormalities. That an infarction also causes depolarization changes to where the QRS can show a telltale sign of some site of permanent damage. Also, you make sure you pay attention to the anatomically continuous leads. Know how you can tell the changes in a 12-lead EKG that can tell you how a patient has suffered from an MI, and how it can either be determined to be an MI or if they are suffer from ischemia. Make sure you understand how to determine the age of an MI. Also, make sure you know your 4 walls of the left ventricle: the inferior wall, the anterior wall, the lateral wall, the posterior wall. How to determine a myocardial infarction location. Make sure you understand how to use your myocardial infarction algorithm, which is this right here. Make sure you understand how to use your algorithm. Also, how you can determine if you have a left ventricular fibrillation. And this is how you can tell. Know your infarction imposters, how you can tell if it's an acute pericarditis or early repolarization. And for the rest of chapter 4, just go back and listen to your chapter 3 lecture that I had put up on yesterday. If you have any questions, just feel free to text me during your review of chapter 14. Or if you're not sure on something, make sure you text me or message me through Emoto saying you don't understand a certain part, and I can go back through it and give you a message back, and we can go through it, or we can maybe set up an immediate Zoom meeting and face-to-face. I hope this helps you in studying for chapter 14 test. If you have any questions, just message or text me.